Hi, Dr. Solverson here. Just taking some time to answer some of the frequently asked questions we get. And probably the most frequent question I get on a day to day basis is whether to ice or whether to heat an injury or an ache or pain that someone will come in with. Um, in a general rule of thumb, ice is the way to go for an acute injury, and heat is better for more of like a chronic or long term issue. So, an acute injury is something like if you sprain your ankle, if you're working really hard in the yard and your back's really sore afterwards, you're going to want to ice that for about 24 to 48 hours. And what that's really going to do, it's going to knock down the inflammation a bit. Inflammation is a good thing, it's part of the healing process, but our body tends to overdo it sometimes, and it can be actually damaging and can delay healing. So, in that early stages, you really want to ice it. It can also give a little bit of numbness to the area, so it can help with some pain relief. But keeping that in mind, you're always going to want to have a layer of cloth in between the ice pack and your skin because it can numb the area. If you leave it on too long, it can actually damage some of the tissues. So you want to keep it to under like 8 to 12 minutes when you're icing it. And then with heat, you can heat an area for up to 20 minutes. You can do it as often as you want to kind of get the muscles to relax. It's really good for loosening up tight muscles. And a big thing people will tell me sometimes is that they like to sleep with like an electric heating pad. That's something that you would also like to avoid because if you fall asleep and have the heating pad pressed against your skin too hard, it can actually burn your tissues too. So that's something you want to keep that to about 20 minutes, and it's can just help with modifying some pain relief as well as kind of loosening up really tight muscles.